I'm now going to introduce our first speaker. It's Stephen Dodd from NHS England, who is the Digital Strategy Lead for Empower the Person at NHS England. Stephen has worked in the NHS, public sector, for over 20 years and is currently working with other STPs in terms of developing that. And hopefully will come and work with us in Lancashire, because we're certainly doing a lot of this stuff. So I'll hand over to you. Thank you. He's got his clicker. That way around.
Morning, everybody. Thank you very much for inviting me today. I'm really pleased to be here for a number of reasons. One, kind of working within the national team, it's really great to kind of get out and actually see what's happening on the ground and get to understand if what we're doing within the national team resonates with what we're doing locally, and also accepting that in this space, you know, innovation and kind of things happening locally is really, really important. And it's good for us to see how that fits in with our plans and that we're kind of heading in the right direction. And also, as Declan said, I'm working with an STP on the Yorkshire coast 2 days a week. And you know, there's some challenges there. And if we can get the kind of level of enthusiasm and engagement you've got in this room, then I think we're doing really successful. So I'm keen to learn from today. I'm within the Empowering the Person work stream, probably what you would have known as Domain A back in 2020 days, and we are focused around anything that is patient-facing. So you can see some of the programs that we've got within there, such as GP Online, Wi-Fi, NHS apps, NHS Choices. And we're keen to kind of make sure that patients want to interact with the NHS digitally as their first priority. Now, that's not always going to be the case. That's our aim, that's our goal, and that's our aspiration. And if we look at some of the programs that we've got within ETP, so this is our roadmap, and this is where we're currently at. And this roadmap's available on our website, and it's interactive, so you can go on there and you can click on any of these boxes, and it will take you to more detail about each of those individual work streams. But I want to talk about a couple of key aspects that are in there. So, for many patients, NHS Choices is probably how they know us. That's our brand. They interact with it a huge amount, and actually it's not just in the UK, it's globally. It's a huge attraction for many, many people looking for health-related information. But what we need to do with that is actually to make it much simpler and much more accessible. So what we're doing at the moment is a redesign exercise going on. That's happening over time. And what we're doing is we're bringing the reading age of that website down by about 3 years to make the information on there more accessible. But what you also want to do is you want to open that information up. So we're making it easy for that data to be syndicated and for you to use that information in your own websites. And then within within England, GP Online is probably the next place where patients would come to us. And we've seen a good level of registration and uptake. So I think we're probably going to end the year at about 30%. But what we've seen is that uptake in registration doesn't correlate to an uptake in usage. And the feedback I get when I go out and about is, well, yeah, I registered and it was a pain, but I got there and then I logged on once and then I never used it again. And that's not a great patient experience. So we will be launching the NHS app later in the year, hoping to have the first private test sites in December. And that will be an app that will be universal. So it doesn't matter whether you've commissioned additional services in the area, because I know there are other apps out there, and there are patients that get a great digital experience, but that's not true across all of the country. So the NHS app will be universally available, and your experience will be the same whether you're a TPP, an NPS, or an EMIS practice. And that will be backed up by Citizen ID, which will move some of the pain of that registration process away from GP practices. It will move to a more electronic, more seamless process. And it will be for the first time we'll have a universal ID for all patients in the country. And then after that has been successful on NHS app, we'll be syndicating that. So that will be available for all vendors to use. And that will actually be a major step forward. So instead of multiple logins for your hospital system, your NHS app, your PHR, there will just be one ID for patients, and that will be a major step change for us. We have the app library. I think it's fair to say there's a fairly eclectic mix of apps on there at the moment. Some of them quite well integrated, some of them not. But it's interesting, it's moving us forward, because some of the things we're seeing and some of the evidence of the research that we're doing is that, say, in some of the therapeutic apps, actually, although they're relatively basic, the outcome for patients is broadly similar for digital as it is for a physical interaction. But obviously the cost of the digital interaction is relatively small, and the cost of and the inconvenience to patients of the kind of physical interaction significantly more challenging. So, not saying we're getting there, but there's some interesting stuff happening, and I think what we don't want to do is not learn from the stuff that's going on there. So that's why we're keen, even though they're not always as well developed as we'd like to see, to kind of promote that work. There are a set of assessment standards that we use for that. There's a new version just about to be released, and what we're suggesting is actually they're open design standards. So if you're thinking about apps or work with patients, that actually that assessment would be useful for any patient-facing service, whether it's an app or not. And that will be backed up by a design standard and a design guide coming out later on in the year. We've just released some guidance on access to personal health records. I think fair to say that's kind of work in progress at the moment. We've drawn together a lot of initial guidance that's out there. We're keen to develop a community of practice around that. Obviously, tying in work with the libraries and your own local experiences around shared care records is fundamental to that. And that obviously needs to link in with the design standards and to make sure that that kind of starts to give us a more consistent approach and look and feel in terms of how we interact with patients. I think the tension we've got in the system is, on the one hand, we want to innovate, but on the other hand, that plurality of access for patients is confusing. They download something and they think, oh, that's going to give me access to my record, and then they discover it's not quite what they thought it was. And that lack of a single access point into the NHS from a digital perspective is a challenge, but we don't want to stop the innovation at the same time. So we're in this kind of mixed economy world at the moment where we need to balance those two tensions. And then finally, in terms of our other programme, we've published a couple of months ago the Widening Digital Participation Guide. I don't know if people have had a chance to see that. Early versions have been around for a while, acknowledging that actually we don't want to leave anyone behind, so digital participation, digital inclusion is important. That guide is really, really useful. It includes a set of tools and guidance in terms of how to access hard-to-reach parts of your communities. It has case studies in there around working with new mums, access for home and services. It has some reference material in terms of socio-geographic stuff for your area. So if you haven't had a look at that guide, I would strongly recommend that you do so. And then finally, I just wanted to touch on our experience of 111 online in Yorkshire. So we went live with 111 online, which is the digital version of the telephony service, last December. And we pretty much did everything you shouldn't do launching a digital service. We weren't allowed to talk about it. We did no publicity. There was no social media campaign. If you wanted to find out about the service, you had to basically ring up 111, wait for the phone not to be answered and go to the voice recording message, which would then give you a URL. You had to be sufficiently interested to want to write that URL down to access the service, because you couldn't Google it. Yet, actually, we saw usage straight away. And now we're at 10% of all 111 triages being online. And you still can't, well, you can Google it now, but you can't actually find it easily from the NHS Choices website. And we're still not actively promoting it. So what that shows is actually, that the demand is out there. And although the demographic you would expect to see was kind of 20s and kind of female, actually what we're seeing is it's spreading through word of mouth. It's actually spreading through conventional, non-digital ways, and people are finding the service and they're wanting to use it and they're coming back to use it. So we have to absolutely accept that this is what patients want, and we have to be able to deliver these services, because If we don't, then there are other people in the marketplace, as we've seen, that will do it for us. And actually, rather than it just being a means to accessing services, it's becoming a means to direct people to services, or it's actually giving the choice to people where they're getting their services from. And that's a fundamental shift from what we've seen before. So, thank you very much.
Thanks, Stephen. I'll just spend a few minutes responding to Stephen, and then we'll try and squeeze a question in before Stephen has to leave us. So, in response to the national asks, and knowing both our geography, our population needs, and I've had to script myself to stay to 5 minutes. Can you imagine me staying to 5 minutes? So I'm just going to read through my script and pull out the salient points. So, Stephen's just talking about how our public are proving to us that they do want to manage their health online. They really do. And make their own decisions and go to decision-making tools to make choices for themselves and only connect with us when they need to connect with us. So it's our job and our responsibility to make it as easy as possible, as easy to manage your health online as it is to book your holiday, to shop or to bank safely. So the strategy, have you got the clicker? Thank you. The strategy has 6 shared principles, our digital strategy. And the 2 particular ones that resonate with this theme are the top 2, that's rather in green, and the grey is shaded out. We'll talk about them later in the morning. And what we're committing to is we will create digital solutions with the people who will be using them. There's no point us, with all your expertise, trying to best guess. And yes, some of you are the public, yes, some of you are the patients, so you're, obviously you count in terms of your opinions, but we have to engage widely and make sure that the solutions that we take to our public are solutions that do make it easy to access services. So if we want to introduce a new app or expect a patient to look online at a trusted site, there's a lot of work that goes behind that, and we do need to understand the needs of our public and respond to them. So this refresh of the strategy confirms our commitment to connect to communities by involving them, learning from them every step of the way. And then to prove our commitment, we'll actually judge ourselves as a health and care economy on how easy it is. Not how well our organisation's doing or what our organisations need, or the stuff, the digital stuff that we've got, or the needs of the health and care system. And I know Amanda boldly stated that there's a lot of needs there, but that's not how we're going to judge ourselves. We're going to judge ourselves for how easy it is for our public to access digital technology and sweat the assets that that brings. And this serves as a significant shift for us in terms of our thinking. And in the refresh strategy, in the infograph that captures our strategy, we are physically putting patients and the public at the heart of our offer. And you will see that when Dr. Colin Brown speaks later. You'll see the infograph that demonstrates that. And that's not tokenistic, it's real. And that does impact on some of the decisions we make, where we invest our money, how we take our public online. And then I'm a psychologist, so I've got to say this. There's no point us just enabling things to happen online and things to happen digitally and things to happen easily and just expect our public to go with it. There is a significant amount of work behind that to ready the public and to ready us as a health and care economy to achieve that. And there's books and books and books about change theory and how you create change and you bring change about. And it's not as easy as writing as a strategy or believing in something. There has to be a programme behind that. You set your long-term goals, making it easy for our public to manage their health and their own well-being. And then you go right back to the beginning and you plot out everything it will take to get people to the end of that journey. And that's our job in the room. And that's what the digital strategy tries to capture. It has 5 interconnected themes. They're all interdependent. And only if we realise across all of those goals will we make any difference to the public that we serve. And just to conclude, we do know that digital will not work for everybody. Not everybody has got access to digital. And if they haven't, we'll do everything in our possibilities to try and help people connect because we know that they'll get added value from connecting. And if they don't, obviously there's no other... never forget that technology will replace the compassion that our frontline workforce can offer. Have I got time to ask the audience for a question? Anybody got a 20-second worth of a question? Oh, first come, first served.
Right, Steve, thank you very much. My name's Nick Wood. I'm CPIO at an acute hospital, Lancashire Teaching Hospital. But we talk about health and care. You work for NHS England. I know that the Secretary of State for Health is now the Secretary of State for Health and Social Care. Where are you going to align with delivery of social care?
I think, yeah, we're starting to have those conversations because we're certainly, when we're doing a lot of work with the kind of personalisation and teams and the activation teams, actually that is where the boundaries between those start to become more important. I think we need to have some more conversations because we're not there with it yet, but we need to, it's certainly now in our thinking.
But it's a direction of travel.
It is, yes.
Okay. Mindful of time. Thank you very, very much, Stephen.